forward in terms of getting the PPE that was necessary, and we're still doing that at the present time. However, we've also learned that we can't, in the future, necessarily depend solely on sort of a globalized supply chains. We have to be more self-sufficient, and that speaks to the innovation that we've obviously undertaken here in Canada with ensuring and building up a capacity for domestic production. So I think those are some of the things that we've learned as we've gone along, and I certainly feel better about, I think, our situation the way we are, where we are now compared to, let's say, back in January, February, and certainly we'll continue to review and improve as we go along.
Mike, do you have a follow-up?
Yeah, my follow-up is related back to what Dr. New said a moment ago about how to party this summer. Given the messages that you've been trying to give to Canadians, given the risks to seniors that you've again, the devastating impact on seniors that you've again outlined today, what explanation do you have for the fact that people in great numbers couldn't follow the scientific medical advice that you were giving in the spectacle that we saw of what happened in Quebec bars, and how concerned are you that Ontario is setting the stage for a repeat starting today?
Thank you for a good question. There's a lot in there. I would say that, I'm not a behavioral science expert, but certainly we've been working closely with those who are more, I think, expert in behavioral science to understand what drives human behavior. I think by and large, most Canadians, certainly during the winter months, were very, very good in terms of understanding, appreciating, quote, the scientific advice. And as the country was in lockdown, keeping themselves limited as much as possible to their homes, maintaining a tight social bubble, the good hand hygiene, physical distancing, and of course later on the use of face coverings and masks. But I think with anything, there's always, I think, a bit of a fatigue factor, and certainly I think that that's come into play a bit now, especially with the warmer weather and people getting out and starting to, I think, get out of their cabin fever, if I can call it that. But the other aspect, which I think I highlighted and I would like to focus on, is also, I think, the issue of young adults. Certainly, I think it is concerning that we're seeing the data show us that a greater proportion of our cases are now among what we call young adults. Those are less than 40. And I think part of that is something that I think all of us, myself, I was young once, and I can remember that when I was younger, I thought I was invincible. You can do anything, don't worry about it, it'll be okay. I think a part of the reality today also is that we also recognize, and I think the young people have also seen that COVID-19, in terms of, everyone's equally susceptible to the risk of getting COVID-19, but in terms of the health outcomes, it is true that overall young people tend to not have at the same rate serious health consequences compared to older people and those with underlying medical conditions. Having said that, I think we have seen some anecdotes of young people having severe outcomes. So you can't consider that everyone is sort of immune from having serious consequences. I think we've even seen in the press, celebrities and so on that have had unfortunately serious outcomes. But I think that the other part that's also very concerning is that with the young people, even if they may have a mild illness or even be asymptomatic, they of course are part of our society, and they obviously go to the workplace. Maybe they work in a fast food restaurant. They obviously have parents and grandparents, so that the possibilities of them transmitting or being in contact with others is what I think is a major issue. Certainly, I would tell young people, including my own kids. I have 3 kids in their 20s. They've heard it 100 times from me already. Hey, you need to also take some personal responsibility. It's not only to protect your health, but to protect the health of all others in our society. And I think people understand that, get that. I certainly, when I've gone out, I've seen many young people actually take the right precautions in terms of face coverings, using their hand sanitizer, keeping their physical distancing. And I think it's just something that we need to keep, unfortunately, hammering home, because until we actually get an effective vaccine or treatment, these are the only things we have at our disposal in terms of slowing down or at least limiting the transmission of COVID-19.
Okay, we'll now move to the room. David, CBC?
You were young once. How old are you? So I'm just wondering, like, as restrictions are relaxed, what is your red line? What are things that you can do now that you're permitted to do in Ontario and, if you travel to Quebec, that you won't do because it's too risky?
I think, as I mentioned before, I think at the end of the day, governments, public health officials can always put forward guidance, and obviously, in the case of governments, they can actually use regulation or legislative means to try and limit the possibility of further transmission of COVID-19. But at the end of the day, I would really say it comes down to individual, sort of personal responsibility for all Canadians, and I think it also then comes down to the matter of what I would call individual risk assessment and risk tolerance. I can't speak for anybody else in terms of what my own personal risk tolerance level is compared to someone else. Someone else, if they take all the right precautions, wear a face mask, hand sanitizer, etc., they may feel comfortable going into a bar. That's their choice, and they need to understand what the risks might be as we give them the scientific evidence about ventilation and how I think I even mentioned that if you go into a bar with the best of intentions, wearing your face covering, making sure you're keeping your physical distancing, maybe after one or two drinks, maybe your inhibitions and your judgment might be not the same as it was when you first entered the bar. For me personally, at the present time, as someone asked me the question, I'm looking forward to the NHL resuming. I'm a big sports fan, but I'll be doing it in sort of my own tight social bubble and watching the games at home. So that gives you an idea in terms of my own personal risk tolerance level, but I really can't make that call or make that choice or decision for others.
Okay, no patios for you. So, but that's perfect segue.
Okay.
Do you want to answer that?
For patios? I would say that compared to being indoors, I would probably have a higher comfort level with that. I would still say that for the time being, and certainly what I've done is that my outdoor activities in terms of eating have been restricted to, I think, family barbecues with physical distancing in my backyard with my tight social bubble. But outdoor patios and so on, I think if there's proper distancing and all the other measures put in place, hand sanitizer, people respecting, the other good public health measures, then I think I would be more comfortable. I think the other way to look at it is that certainly from the scientific evidence, what we've seen is that indoor spaces are at higher risk. And I think I've used the analogy before of cigarettes and cigarette smoke. So if you just look at, we can actually see a cloud of, cigarette smoke. And if you were outside with a smoker, and I'll tell you right now, I'm a sort of a strongly anti-tobacco. I'm a public health person, so that's another aside. But if you were beside a smoker, and none of my friends are smokers, by the way, then if someone were to smoke, you could see if you're outdoors on a patio and there's good air currents, that the smoke would dissipate much more rapidly, and you wouldn't really be exposed to it for a long time. So that might be the same way you might think about your potential exposure to small or aerosolized droplets of COVID-19. However, if you were indoors in a restaurant or a bar, completely different situation. If you were in close sort of proximity or contact with a smoker, that cloud of smoke certainly lingers for a longer period of time, and your potential exposure is increased. And so we can think of that, the analogy of cigarette smoke in the same way for COVID-19. So if the question is, am I more comfortable on a patio outside compared to being indoors, I would say yes, and that's the reason why.
Now for my real follow-up.
Oh, really?
Okay. Baseball. The Ontario government, a minister in that government, is confirming that they have received the final clearance and that everything is, let me just read the headline really quickly, they're all clear to play at home. Can you give us an update on that? What's the federal government's position? What's your, are they just going to be able to play here and travel, and are teams going to be able to come here and play?
If we've got the time to give you a long answer, I would say that the short answer is that the federal government, obviously we're still looking very closely at the proposal put forward by both, I say, Blue Jays and Major League Baseball. And certainly we've had good discussions, conversations involving both local officials from the City of Toronto as well as provincial officials, the Blue Jays and Major League Baseball. I think I'll just give you a couple of thoughts. Going back, stepping back, I would say again, hey, Canada, we've done a good job overall relative in terms of flattening the curve. Look at where we are right now, about 300 or so cases per day. But that success that we've achieved, I think, is fragile. As we've seen, it just takes a few sparks, and we can easily backslide to having many more cases. So that's something we need to keep in mind. As part of that, risk management, if I can call it that, for COVID-19 in Canada, we've done a good job in terms of, keeping our house in order here. And so the other thing we need to look at is that how do we manage the risk of importation of COVID-19 from elsewhere? And so certainly from a federal government perspective, one of the key things we're responsible for is the international border and the Quarantine Act. And what I would say also is that, at the present time, what we know about the disease, the 14-day incubation period, that's why we have this very, I think strict, but, reasonable sort of obligatory 14-day quarantine for anyone who comes from outside who comes into Canada, so that we can keep track and make sure that they don't import the risk of having COVID-19. After the 14-day quarantine, with the sort of the understanding that they're clear of the virus, then of course we expect them to follow all the public health measures to not be at further risk of exposure. So that's the thinking from, I think, a federal government perspective in the Quarantine Act. So here we are looking at the epidemiology of COVID-19 in Canada, and we all know what the epidemiology is of COVID-19 in the United States. Looking at the plans of Major League Baseball, I would also maybe in some ways say that, hey, looking at all professional sports, all of the plans submitted, there's none that's risk-free. In essence, life is not risk-free. So it's all, again, a matter of risk management. For the NHL model, I think it's closer to what we would be comfortable with in the federal government because, as you can see, they've chosen the 2 hub cities in Canada. All the players and all the essential personnel involved with the production of the games have crossed the border into Canada, have observed that 14-day quarantine in terms of their training, and then we would maintain that tight bubble in terms of regular testing, making sure that there's no risk of exposure, keeping them, obviously, the players and essential staff separated from the general public. In the case of Major League Baseball, what the construct is that, the teams, and the Blue Jays included, would be, during the regular season, traveling back and forth across the international border. And that, I think, is an issue. And I think to their credit, the initial plan from the Blue Jays submitted to us had them during the regular season, as opposed to the training camp where we had permitted them to come in because it was a tight bubble, a 14-day sort of modified work quarantine, staying, strictly to the hotel and sort of the Rogers Center in terms of training. During the regular season, the proposal initially was, they can just live in their condo or summer residence and so on and be part of the community. I think it's to their credit that the Blue Jays understand how seriously we're taking COVID-19 here in Canada and the measures we've put in place and why we as a country have, I think, relatively successfully managed COVID-19 in Canada. And so the modified proposal from their perspective is that they would also maintain that quarantine bubble even through the regular season. So should they go to the U.S. For games and come back, they would still maintain that tight bubble. There'd be no family members coming to join them, etc. So kudos to the Blue Jays for, I think, making that acknowledgement and also the commitment, making that sacrifice, if you want to call it, in terms of what they're prepared to do during the regular season. But the fact remains, the Blue Jays, if they go across the border, I'm a sports fan. I know where they'll be going to play games. Florida, there's the Tampa Bay Rays, the Florida Marlins. Look at the Atlanta team in Georgia. And then, of course, with the construct of Major League Baseball at the present time, you've got the other teams coming up to Canada. And certainly I don't think they're under the same tight sort of bubble in terms of what they're doing in their home cities as what we're doing here in Canada. So those are some of the factors that are certainly in play as we make our continue our deliberations here at the federal government level. Thank you.
Okay. Next question, Mackenzie, CTV.
Hi, Mackenzie Gray with CTV News. Ms. Quelcho, my questions are for you. On the We Charity front, how many times has We Charity submitted unsolicited proposals to you, your office, or your department? And how many times have you spoken with anyone from We about the Canada Student Grant Program or any other issues?
I'll answer your second question first. I have not spoken with anybody at We. This was not my file to carry. I had the other student measures and the jobs, the student benefit, and the student loans and grants. In terms of the exact number of unsolicited proposal, I don't actually know the answer to that. It's very common to get unsolicited proposals from organizations, particularly organizations that are have worked with the government before. So I can get that information for you. I just don't know the answer.
So it's fair to say that we had sent multiple ideas to you on that front. And my follow-up is, we is having conversations with the government. They are submitting these unsolicited proposals, and the government is having conversations with we about issues of fairly substantial sums of money, but we is not registered to lobby the federal government. Do you think that's an issue that we is not registered? And why did the federal government and people who potentially were working in your department, I'm not 100% sure, know that we was not registered to have those conversations?
Let me clarify. I can't tell you if there's been multiple. The two I know of are one with respect to youth entrepreneurship and one with respect to the Canada Student Service Grant. My office, I did not receive those in our office, but I do understand that they were distributed to other ministerial offices. I just don't know the details of it. I was not involved to that extent with this file. And I can't remember your second question. I apologize.
Lobbying and the fact that they weren't registered.
Hey, listen, I think we should always err on the side of caution. If you are in the business and if your core business is lobbying the government of Canada on a particular issue, you should be registered with the lobbyist. But it's, again, not my area of expertise. And it's something perhaps that any organization may want to look into themselves.
I just want to clarify one really quick thing. A report or a proposal for the Canada Student Grant Program to the government, correct?
Yes, as was testified to yesterday by the Minister of Diversity, Inclusion and Youth, the government of Canada did receive unsolicited proposal from We Charity the day of the Prime Minister's announcement of the $9 billion student package.
Okay. We're going to move back to the phone. Operator, can we get, do we have any questions?
Thank you. Merci. Our last question is from Marie Vestel avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour, Dr. New. J'aimerais revenir sur les restaurants et les bars. Vous avez clairement indiqué qu'il y a des risques associés au fait que c'est des espaces clos. Des fois, il y a des problèmes ou en tout cas, la ventilation n'est pas idéale. Sachant ça, est-ce qu'il est adéquat que les bars et les restaurants soient ouverts dans certaines provinces en ce moment?
Merci pour la question. Je pense que c'est vraiment une décision à prendre pour les autorités des provinces et territoires parce que c'est eux, ils sont plus, comme on dit, sur le terrain. Ils ont le contexte aussi, l'épidémiologie avec qu'est-ce qui se passe actuellement dans leur administration. Pour moi, c'est difficile parce que on peut parler vraiment d'un cas individuellement d'un restaurant. C'est possible qu'un restaurant a une bonne ventilation, des autres facteurs. Et c'est tous les facteurs que les autorités à l'échelle des provinces et territoires doivent considérer. Ce n'est pas vraiment pour moi pour commenter, dire quelque chose à travers le pays.
Question de suivi, Marie?
Follow-up question, Marie?
Vous dites que le nombre de cas est en train d'augmenter au pays et puis vous faites un lien avec les activités des jeunes en citant le cas des bars. Est-ce que vous avez un seuil ou est-ce que vous surveillez la situation attentivement et jusqu'à combien de cas par jour est-ce qu'on peut monter avant qu'il y ait réellement un problème et qu'on recommande de reconfiner certaines de ces activités-là?
Confining people once again or
merci pour la question. Je pense qu'il n'y a pas comme un chiffre exact. C'est vraiment une question d'examiner qu'est-ce qui se passe actuellement à l'heure actuelle dans chaque province et territoire, mais aussi à l'échelle locale, municipale. Nous continuons nos discussions dans le comité consultatif spécial avec nos homologues des provinces et territoires. Et c'est sûr, c'est eux qui suivent la situation dans leur administration attentivement et étroitement. Et nous autres, c'est intéressant parce qu'en partageant nos expériences dans toutes les provinces et territoires, parce qu'une expérience dans une province peut aider peut-être les autorités dans une autre province pour les mesures à prendre. Par
measures to be
exemple,
taken, for example.
c'est une autre situation, mais
Well,
on
this is
sait
another
que
situation, but
la Colombie-Britannique et
that
le
British
Québec
Columbia,
aussi a ouvert
Quebec
leurs écoles d'une
also
façon
opened
limitée
their schools
pendant
in
le
limited
printemps.
measure
Et
in the
maintenant,
spring.
toutes les provinces et
now,
territoires,
all
aussi
provinces and
nous autres à
territories,
l'échelle fédérale,
on the federal level
on
as
a
well,
discuté, on a
had
vu
discussions.
c'est quoi les résultats de
And we looked
leur
at what the
expérience
results
dans
of
les
that
deux provinces parce que
experience was in
ça
the
va aider
provinces
avec les données
because it will
probantes
help
aussi,
us with
l'évidence
evidence
pour aider toutes les provinces et
to help
territoires
all provinces and territories
pour qu'est-ce qu'ils peut-être veulent faire pour
in terms of what they
l'automne
would
et
like
les
to
écoles.
do for reopening their schools in the fall.
Thank you. That concludes today's press conference. Merci.
Thank you.